Good morning, everyone, and thank you for joining us this morning for our Meet the Candidates event with Suzanne Herzog. She is running for the U.S. Senate here in the state of Iowa, and we're excited to have her here today to hear a little bit more about her platform and her visions for the state of Iowa, now a week out from the election. It's pretty crazy to think we're a week out, but I think we're all ready for the ads to stop overtaking our TV. So we're excited to have Suzanne here with us this morning. Suzanne, excuse me. Thank you for joining us.
Well, hi, Drew. I really appreciate being here today, and I appreciate the second opportunity. Groups like yours have been very important to me as a no-party candidate throughout the state. So I am Suzanne Herzog, Iowa's no-party candidate for U.S. Senate 2020. That doesn't mean I'm not fun, but sincerely, it is groups like yours that have been very important. As a nonpartisan candidate, I am a bit disadvantaged campaigning without the party organization, the funding, and COVID. But it's important that Iowans understand that once I'm in office, a no party senator has tremendous leverage that money can't buy. With today's narrow party majority in the US Senate, any state that can send a completely nonpartisan senator has incredible leverage. So this is a historic opportunity for Iowans to restore their leadership role in the US Senate. Also, the important thing to remember about that is because of the way Senate rules have evolved around the two-party system, our system of checks and balances is failing. Senators and legislators are not using all the tools in the toolbox, and they're certainly not keeping the other branches of government in check. So when there's so much division and gridlock in government and legislation fails, more legislation ends up in courts. And that's why there's more issues as far as appointing judicial representatives and that. And also they're not doing the checks and balances they should be doing on the executive branch. A good example of that is international trade. Congress has constitutional authority over foreign commerce and tariffs. So there was no reason that we had to allow the Trump trade tariffs to devastate our farmers. And so Congress should have been in there actually way back in the first 3 days of the Trump administration when they got rid of the Trans-Pacific Partnership. Our members of Congress should have been rallying around that and saying, hey, this is with Canada and Japan and 11 of our Asian trading partners. This is the way to have leverage against China in this multilateral trade agreement. And that agreement also had the strongest intellectual property rights in the history of any trade agreement. So that would have been, that was the premise that Trump had. He said, well, they're stealing our intellectual property. Well, that trade agreement had the strongest provisions for that. So we're missing huge opportunities. And again, Congress didn't have to let that happen. We're just kind of acquiescing. So we need our senators to do their legislative duties better. The other reason I'm running is because I'm a healthcare expert and I'm an economist. I was a nurse for almost 20 years before I became an economist. I became an economist to realize the long overdue healthcare reform that our country's been waiting for a very long time. Now, neither major political party is going in the right direction on healthcare reform. The most devastating thing to the US healthcare system has been employer-sponsored health insurance. We're the only developed nation that limited your access to private health insurance by having to get it through your employer for the most part. And this creates horrible adverse economic incentives. So when the Republicans tell you that all we need to do is put more transparency on this convoluted, complex system, which was never a fair free market system, because your access to a quality, affordable policy depended on the size and the commitment of your employer. And it created these really bad risk models where your premiums are determined by how sick the people are you work with or how big your company is. So if we would all be in the same market, private health insurance would serve us better. So we would all get our health insurance, much like we do our car or homeowners insurance, in a well-regulated market where we have good consumer protections. What that does is that distributes risk over everybody in your state, or at least a minimum rating area of 1 million people. And so we know from observations both before and after the Affordable Care Act and how different states implemented it, that it would be more affordable for everyone if we did this. So this is not only better for individuals, but it's better for businesses and it's better for our economy. So how do we get that ball rolling? Well, we take the tax break away from employers that they get to insure you, and we give it to individuals to insure themselves in this robust, well-regulated consumer protection focused market. And so then if we do that, we actually have more people that are privately insured, and that leaves more public funding left over to keep people from falling through the cracks. So that's very important. And so you know, these aren't new ideas. These are ideas that are oppressed because there's, you know, health insurance lobbies or large health network lobby groups and things like that. But this really would serve everybody better. And, you know, corporations aren't evil, private insurance companies aren't evil, but they are organized to act in their own best interests. So, you know, the Affordable Care Act was great. It was about half right. It provided some very important consumer protections. So you're safer if you go to the hospital, you're more likely to have effective care, you're less likely to be readmitted. And as a health economist, I can tell you a lot less money is wasted as a result of it. However, it did nothing to contain costs and simplify the system and make our healthcare system more transparent. And it did nothing to empower you as a healthcare consumer. So both the Democrats and Republicans are wrong. If the Democrats are telling you you can put a high administrative cost public option into this mess and it's going to fix everything, it's completely wrong, because you still have public funding paying for monopoly priced health insurance plans with the Affordable Care Act. So what we really need to do is simplify the system, make it work the way it's supposed to have worked all along. And my plan also completely prevents medical bankruptcies, because what we would do then, we would make Medicaid a better safety net for anyone of any income level. So you don't need any individual mandates. Employer mandates are gone. And by the way, it's been very bad for businesses of many of these medium-sized businesses that aren't too small to not be required to have employer-based insurance. And that's a very high administrative cost thing to have these employer mandates. So those go out the window too. But then we take Medicaid, and it's a better safety net for anyone of any income level, because anytime you would need to access services to prevent medical bankruptcy, you could access them with an income-based temporary buy-in any year you would need it. So we don't have to, you know, reinvent the wheel. We have enough government programs to support people. And, you know, let's give one of my opponents a little credit for something. Joni Ernst said she would sign on to Susan Collins's idea of having federal reinsurance for those extreme outliers, those people that are the most vulnerable and have very high cost medical things, medical issues or conditions. And that's a great part of my plan too. I proposed that too, but it would work much better, because once we completely unravel this convoluted, complex system, we can actually see where public funding is going and how effective it is. What people don't understand when they talk about Medicare for all or something is they don't understand that already 75% of Medicaid is completely privately managed or administered in our country, and a third of Medicare is. So you have this big convoluted mess, and it's not simple enough. So I'm gonna move on from healthcare reform, because we have a lot of other important things to talk about. But the important thing to remember is my plan changes economic incentives so that public health and individuals and payers and service providers have economic incentives to work together to improve the health of communities. And this also finances our small rural healthcare providers better, because they have a more varied revenue base from more varied payers. So back to other things that I've done is, I went to Iowa State to get my degree in economics, and I worked with a lot of young farmers and business ag students there. During my program, and I worked out in Washington, D.C. in 2008 for 3 or 4 months. And I was there for a statistics internship with big federal government agencies like the Bureau of Labor Statistics and USDA and National Center for Health and Education Statistics and Justice Statistics. And that's an important experience to have when you're working in the US Senate, because it goes back to the tools in your toolbox. What people don't seem to remember is that Congress has broad constitutional authority to establish and shape the federal bureaucracy. Those are the agencies. And Congress also may enumerate the powers, duties, and functions to be exercised by these agencies, as well as directly counteract through later legislation certain agency actions that are implemented through delegated authority. So what does that mean? That means that Chuck Grassley and Senator Ernst didn't have to sit by the sidelines and let Andrew Wheeler and the EPA mismanage the renewable fuel standard waivers, and they didn't have to wait on the executive branch. They could have done 2 years ago what Colin Peterson, who is the chair of the House Ag Committee, has done. He's created in a bill that just passed on September 25th, provisions that require the EPA to manage the RFS waivers differently, where there's more transparency. There's a year of end deadline. There has to be a declaration of exactly, who's requesting them and how many, gallons of renewable fuels are being excluded and things like that. So when your senators act like they, they're doing something when they're not, we really have to hold them accountable. Other examples are like, do you remember the Federal Communications Commission broadband maps? Senator Ernst and Grassley in July of 2019, are all up in arms and addressing this with the FCC and saying the broadband maps are inadequate. Well, by that time, it was already resolved. In 2018, May, the year before, we had a bipartisan group of senators addressing this with the FCC. Already in August in 2018, Amy Klobuchar and another group of senators were addressing it with the FCC, so that by the time of the end of 2018 in December, that mapping process was completely decommissioned. And so there was already legislation being crafted and introduced in February of 2019 with a senator that I hope is going to be my mentor if you send me to the US Senate, US Senator Angus King. He's the one really truly independent senator from Maine, but he's also the chair of the Broadband Caucus. And he had come up with a plan where communities would have input to how these broadband maps are designed. So then already by July of 2019, that's when Ernst and Grassley, publicized that they're sending a letter to the FCC complaining about the maps. But already in August, the next month, because of all this work by other senators in the previous year, new legislation was introduced that resolved the issue with the broadband maps. And, when Senator Ernst says she's one of the most bipartisan senators in history, you really have to look at those numbers. Now, as an economist, I had to do a lot of statistics. I like methodology, I like numbers. I went and looked at that study by the Lugar Center in Georgetown that she's referring to. That puts her as a pretty average bipartisan senator. She's ranked like 38 out of the 98 that they evaluated. But what's important to point out, we go back to that FCC legislation, there was 69 co-sponsors. Amy Klobuchar signed on to that in June of 2019 when they had, already gotten that legislation done. And Senator Ernst didn't sign on to it until October, until, a month before it was ratified in December. So, when we really have to hold people accountable for what they're doing, and they really aren't executing the duties of the office. And I can tell you that not only will I be more prepared to represent you, because by the way, your senator should not be imposing any personal views or any single party agenda on Iowans, but should be more directly representing Iowans. I'll be in the best position to do that. I won't be wasting time with party pandering. And on the last note on that, US senators, for the size the state of Iowa, we get over $3 million to manage our Senate office every year. So I can guarantee you, I will be the most responsive senator in Iowa's history to be connected with my constituents, and the most responsive. I'm running for office because I wanted to represent the majority of Iowans. And in this very purple state, when often more people are registered nonpartisan than with either major political party, if you're only representing people in one party, you're representing the minority of people in our state. I wanted to save you time for questions, Drew. I was going to tell you, just stop me.
Well, thank you, Suzanne. That's definitely a lot of good information. You hit on a lot of topics that I want to make sure we expand on a little bit here as well. But just a few brief things as before we get into the Q&A. If you've attended these in the past with any of the other candidates, you will recall that if you want to ask a question, please do type it in the chat box. I will be monitoring the chat box to make sure that any questions from our attendees are asked to Suzanne. And the first question we have from attendees is, how will you work to bridge the divide between party lines? You talked a little bit about that, but is there any other things that you want to share about how you would be bridging that gap between party lines and kind of working in a bipartisan manner?
Yeah, that's a great question. And it's even better to be nonpartisan than bipartisan, because I would just be a magnet for collaboration. You know, one of the reasons why Senator Ernst got a lot of credit for being bipartisan is if you look at how that study worked at the Lugar Center, she gets credit even if one Democrat signs on to something she proposed, or if she signs on to something they propose. And when you're so most of her time in the Senate, she's been in the majority party. So all these minority party people that couldn't get their legislation passed, and by the way, there are wonderful people to work with throughout the Midwest who are advocating for rural communities and farms. So it's really easy to get a lot of credit for good legislation. But what's great about being nonpartisan is I'm going to be that magnet. I'm going to be the person that's the most disarming to my legislative peers that they know they can approach. But also, like I was saying, with this very narrow party majority in the US Senate, I have incredible leverage. Depending on how this election works out, I might even determine which party is in the majority. So if you look at it that way, and then if you look at the fact that, you know, people in the state will be, I will be extremely engaged with, because they know that regardless of party, I'm going to hear and support their positions, but also because I'm an economist and I have experience with data and analysis and proving points. I can make very good evidence-based arguments. So not only for healthcare, but for macroeconomic issues and other issues like you know, education and agriculture, and you know, trying to battle some of the you know, we need a lot more antitrust legislation in a lot of these different industrial sectors. I can make those arguments, so I'm really the best positioned to do that.
Thank you for your answer there, Suzanne. Another question that we have is, we do have Superintendent Murillo from Council Bluffs Community School District on. And one question we've asked all the other candidates as well is kind of, what is your plan for public education, and what do you think you would need to do if elected to the U.S. Senate to help make sure we have a strong public education system?
Well, you know, before COVID broke out, I had met people from all 99 counties, and because I had to get candidate petition signatures, it was very important to me that I had people sign on from all 99 counties to give me permission to run for office. And I wouldn't have run for office if I hadn't had such overwhelming enthusiasm for an independent candidate and the healthcare reform I'm offering, and what people know I could bring for them in office. And I talked to a lot of teachers and educators, and they agreed that one of the main problems they have is it's very difficult to do their jobs, because they have to be social workers, or they have to deal with challenges with mental illness. You know, I'm one of 7 children that my parents had in less than 10 years. And we also took in foster children for Iowa DHS. And so my home was a circus. But the one thing that saved me was the great public schools. You know, when my parents really couldn't look out for all of us, they made sure that I had great opportunities. But at the same time, I had siblings with terrible mental health problems that weren't getting the attention they need. So coming out of the same house, I could really benefit from public schools, but my siblings couldn't. Now, this is a national crisis. You know, we look at education as something that's primarily funded by states and managed by the states. And that's appropriate. But when there's national issues that address our public education system, then we really need some robust federal funding and support. And one of the things we really need that teachers seem to agree with is mental health professionals in all of our public schools. The other things teachers talked to me about is they felt that their hands were tied. You remember before they had No Child Left Behind, and they had these standards, and all their teaching had to be guided by, meeting these criteria and standards, for national funding and that. And then it moved on to legislation that happened near the end of the Obama administration, was the Every Student Succeeds Act. And that gave, and then the way Betsy DeVos has initiated it, really at this point, states and school districts are really, it's states that evaluate how effective school systems are serving kids in our public schools. Now, some people in large public school districts where there were a lot of underserved kids or kids that were difficult to teach, or there wasn't enough resources, they were afraid that a loss of this standardized way of collecting data would disadvantage them when there's federal grants to improve these systems. Now, what I would propose is, it's a little hard to explain, but it's kind of like in health, we have these federally funded community health systems. I know there's a couple in the Council Bluffs area. I think one's called Lakin, one might be All Care or something like that. But what they do is that they serve underserved communities, and also they serve communities where, for whatever reason, there aren't enough healthcare resources. Well, we could do a similar thing in education, because the nice thing about that is this kind of an organizational structure is the most responsive to the needs of a community. So we could have very robust federal funding and grants that can authorize different school districts and areas of different states to communicate their needs of their underserved individuals. Because, anytime you use public funding, there needs to be a level of accountability, and there does have to be some data that demonstrates how well communities are being served. But complying with this data reporting shouldn't be burdensome. So what we've found, though, with community health centers throughout the nation that end up being about 20% federally funded, but then depending on the needs and of the community, sometimes these communities invest quite a bit in them. And like for instance, in these health communities in the healthcare sector, people, even though a lot of the patients are Medicaid or Medicare funded, you can have private insurance there too. So what, I guess I'm getting a little off track, but what I'm saying is that if you give states and school districts the opportunity to have federal funding to better serve their underserved communities, they can come up with some very effective organizational structures and plans to serve that community better. And the only requirement would be is they have to have some adequate metric reporting. But often, like in the healthcare sector, we let them come up with that. Instead of a No Child Left Behind, national standard, one size fits all metrics, we let those communities define those metrics. And that's, I think, one of the best ways to support our public schools throughout the nation.
Thank you, Suzanne. And another issue that we've talked a lot about with the other candidates is some of our local elected officials and local leaders have wanted to know a little bit more about infrastructure. We have a lot of, water and wastewater infrastructure. We have locks and dams. We have levees. You obviously have transportation infrastructure. There's a large investment from Iowa Department of Transportation, and obviously U.S. DOT dollars going into the 2980 interchange and such. So can you talk a little bit about infrastructure improvements and the importance of investing in our nation's infrastructure?
Yeah, now infrastructure's been intermittently a challenge, and as our governments become more divisive with this two-party thing, that becomes more of an issue as well. And again, most people would recognize it as it's a very popular bipartisan issue, but we get all these sticking points all the time. But one thing I can say is on the federal level, we've actually had less and less investment in infrastructure. About 35 years ago, we only spent about 1% of national GDP on infrastructure. And over the last 35 years, it's diminished to only 0.5%. So realistically, we do need more federal funding for infrastructure. Now, primarily the states really have to get on board too. There's only 9 states probably in the last 20 or 35 years that have maintained the same level of investment in infrastructure. But so it's a problem on both the federal and the state level for whatever reasons. Now, we had the big economic financial crisis in 2008. We've had a lot of things. And just as states were recuperating, you know, now COVID's hit, I think there was a lot of infrastructure projects that were already happening. So then they were hit hard again. And now, you know, we're looking at, you know, certainly counties is another issue because, you know, the National Association of Counties points out that a lot of these roads, at least 40% of infrastructure on roads and like 36% of airports and things are the jurisdiction of counties. So we have to involve them in the mix as well. But the main important thing to recognize is that right now with very low interest rates, the way moving forward really is taking on, for some of these states to take on more loans and debt, but the federal government can back them up. You know, we do need to look at more efficient ways of having revenue. It is true that the fuel taxes or gas taxes are going to be increasingly not the way to raise revenue. There's all sorts of different mechanisms that we can use, the vehicle mileage tax, and we can do that without disadvantaging, you know, some of our manufacturer shipping and commerce and that we have to look at that source of revenue too. But basically, states have to invest more. The federal government definitely has to invest more. We have to kind of look at all our options. Bonds can be useful, especially now with low interest rates. If we set municipal bonds, we make sure that they're still tax exempt for municipalities. But then we also need to make sure then those interest rates can be competitive at this time, where investors will say, well, hey, this is maybe something we're putting my money, because right now, you know, the treasury bills are not going to pay a lot in the long run. So this might be a good opportunity to have more municipal bonds that are federally backed and more of those loans, just because of the way the interest rates are at this time.
And one of the other issues that's really important and critical to our members and our businesses here in the Council Bluffs and Pottawatomie County and Southwest Iowa region is workforce. We just hired our workforce director here at the Council Bluffs Chamber to help our members with this very key issue that's the number one issue for most of them. So can you talk a little bit about just the importance of workforce development and what, if any, role you feel that you would need to play as a potential U.S. Senator in addressing that issue?
Well, sure. You know, I noticed that I think it's Iowa Western Community College is in your area. And I noticed actually I think it was last week when we were getting ready to be on your Zoom meeting here that the chamber is involved with the Workforce Investment Act. And that's a federally funded thing to help dislocated workers and maybe I think it was low-income adults and youth and that to start to get into those programs. And so those kind of programs are very important as well. But, you know, even before the pandemic, one of the things that's hurting people in communities where they can't advance education and skills is we have to remember that, you know, the healthcare reform that I'm proposing is incredibly important on that front. When we free up businesses and we free up individuals and healthcare is not in the mix when you're considering, you know, where you should put your skills and what you should be doing for a living, that's going to be incredibly important. But at the same time, what the other point we were going to make on that is we really need to do something about affordable housing and about student loan debt. So the student loan debt that already is out in the nation is 1.6 trillion. And, you know, right now, even just for pandemic relief, we're proposing relief packages of 2.2 trillion. And I'm not for forgiving all student loan debt, but we really have to change economic incentives of how higher education works and how it's backed with federal loans. So what I would do is we need to have income-based repayment for all current loans and for all future loans for higher education. And that income-based repayment, I think, shouldn't even start until you're making $30,000. Now, Purdue University is kind of leading the way on this, and they're making it work, and they weren't obligated to do it this way. But that's really the only way we can hold higher education accountable for making sure that we're giving students value. And before we put public dollars into federal student loans, we have to make sure that these are quality programs. We definitely need to crack down and eliminate funding for scam, low quality, high cost trade, these schools. So, that's definitely something we need to address. We need to be more judicious about how federal funding works, and we need to create economic incentives so that higher education is really giving our students value. So again, I would say that all federal loans in the future should be income-based payment. Repayment shouldn't start, or there should be loan forgiveness, and if you're making under $30,000 a year, the repayment should start only after you're making over $30,000. And there's so not only do we need to support the programs now, Iowa's community colleges have done great, like a lot of community colleges throughout the nation, where there are public-private partnerships, there's great apprenticeships going on, and those need to be supported. But if we don't get this funding straightened out, and we're wasting a lot of money on low quality plans, or we're devastating students where they can't invest in their own well-being in the future because they're burdened with student loans, it's just not going to work.
Thank you, Suzanne. And the last question I have for you, out of everyone's respect for everyone's time, because we are coming up on a half an hour here, is, what makes you unique, and why should people cast a ballot for you on November 3rd? Kind of your final sales pitch, a week out from the election.
Well, first of all, I think you should vote for me because this is a historic opportunity for Iowans. If you really wanted to change how campaign finance reform works, you really want to break through government gridlock, and you really want to make the federal government work better and change the Senate rules that have evolved around this really broken two-party system, this is your opportunity to do it. One of the reasons I'm running is because people I talk to around the state, and my friends said, well, this is the kind of candidate we need. And we thought, well, we could wait for that person to come along, or we could put somebody forward. And it happened to be me because I had the federal government experience. I'm an economist. I took care of people for 20 years as a nurse, so I have the healthcare background. And as Teresa Greenfield would tell you, that's the #1 issue that Iowans bring up is healthcare reform and that. So if you really want to get something done, I think that my healthcare reform, I know we can get through Congress. I have bipartisan support. I have many support of business people throughout the nation because they know that this is the way to move forward. We should have never had our complex healthcare system integrated with our labor markets and that. And once we change that, we can really free up everything and make it better for everybody. Also, we didn't get to touch on the pandemic relief, but as an economist, I can tell you, if you look on my Facebook page, I was on board with the U.S. Chamber of Commerce proposals for this middle road ground of how we provide unemployment insurance and support our economy. And you can look at that too. But basically, I think I just have the right skills for the job at this particular moment in history. I'm for term limits. So I will be the most effective senator you've ever seen in my first 6-year term. And, the only case scenario where I would run for office again is if the people for Iowa are rallying for it, if we have something in that first term we absolutely have to get done. But I will limit myself to 2 terms. We have to prepare the next generation to be involved in legislation that's going to affect them in their future. So I would make sure that we have a good transition where they can keep moving on the momentum that we've established to benefit Iowans and Americans.
Well, Suzanne, thank you again for taking the time to be with us today. We appreciate your flexibility and everyone else's flexibility as we work to make sure that we had an opportunity to speak with you. So thanks for being with us today, and everyone, thanks for being on. Today we do have, as a reminder, we will have Rick Stewart at 12 o'clock today, who is another candidate for U.S. Senate. And then we'll have Senator Ernst tomorrow morning at 10 a.m. So do please feel free to join us for our final 2 Meet the Candidates. But with that, Suzanne, thank you for joining us. Thank you, everyone, for being on with us. And it was great getting to know you and learn a little bit more about you.
Thanks so much, Drew. And best of luck to all of you, and have a happy, healthy fall season.
Thank you.
And I would appreciate your vote. We need to get some things done. Thank you.
Thanks, Suzanne. Thanks, everybody. Have a nice day.